Hello, how are you today?
Good, how are you?
I'm well, thank you. My name is Patrick. I'm going to be your student nurse today. I'm here to do a head-to-toe assessment. We did your vital signs earlier. Before I get started, if I could just close this curtain, give us some privacy. And then I need to check your wrist for your name and date of birth.
Sure.
Alright.
Aiden Hermes, January 9th, 2002.
Perfect, that is correct. All right, I'm going to be asking you a series of questions, just going through the physical assessment. First, can you tell me, how did you sleep last night?
I slept pretty good.
And how has your appetite been?
It's been okay.
All right. And can you tell me what brought you here today?
Just a headache.
Just a headache? Okay. We'll get back to the headache in just a moment. You told me who you are. You told me your date of birth. You told me why you're here. Can you tell me around what time it is?
About 10:30-ish.
Okay. And then can you tell me where you are?
NSU.
NSU. Okay. The patient is awake, alert, and oriented times 4. Times 4. All right. Now we're going to go back and we're going to assess some of those things that you mentioned. Can you tell me when your pain started?
About 3 days ago.
3 days ago. Okay. And can you point to where it hurts for me?
It's about right here.
Okay. All right. And then can you tell me, is it constant or does it come and go?
It comes and goes.
Can you tell me some of the characteristics of it?
Just really a lot of pressure and it kind of throbs.
Okay. Does anything aggravate it or make it worse?
Just bright lights and loud noises.
Okay. Is it radiating and moving around, or does it stay right there in the same spot?
It stays pretty much just right here.
Okay. And have you done anything at home to treat it?
Just took some medication.
Okay. And as far as severity goes, on a scale from 0 to 10, rating your pain, 0 being no pain, 10 being the worst pain, where would you rate yourself?
Right now about a 4, but it gets to about an 8.
Okay. I'll see what we can do to get you some pain meds here in just a few minutes when we finish the physical assessment. Okay. I'm going to move here into looking at your eyes and some of your cranial nerves with your body.
Okay.
I'm going to start by holding up a certain number of fingers. If you could just tell me how many fingers I hold up.
Okay. 4.
All right. Cranial nerve 2 is intact. All right, I'm going to move over here to looking at your eyes. I'm going to take this pin light and I'm going to shine it in your eyes. If you'll just look forward, I'm just checking to see if your pupils constrict and relax. All right. I'm going to take this pin light here in front of you. If you'll just look at the pin light and look at the wall, look at the pin light, look at the wall one more time, wall. All right, and then I'm going to take this pin, I'm going to move it in the 6 fields of gaze. I'm going to move it up. Just watch it, keep your head straight. Alright, the patient has Perla. Pupils are equal, round, reactive to light, and accommodation, and there is no nystagmus noted. Alright, that was cranial nerves 3, 4, and 6. Now I'm going to check out your lips and your mouth. If you would just open your mouth and say ah, stick your tongue out. Alright, the lips are pink. There doesn't appear to be any issues with chappedness. Mucous membranes are pink and moist. There are no lesions, and there appears to be good dentation. If you could clench your teeth for me, smile, puff out your cheeks, and raise your eyebrows. All right, cranial nerves 5 and 7 are intact. I'm going to whisper a couple of letters and numbers at your ear. If you could just repeat those back to me.
1, 2, 3. ABC.
All right, perfect. Cranial nerve 8 is intact. Earlier, I looked in your mouth. I saw your uvula and your soft palate rise. Can you tell me, have you had any issues swallowing?
No.
All right, so cranial nerve 9 and 10 are intact. I'm going to take my hands and put them on your shoulders. If you just shrug up for me, and then if you'll turn your head to the side, right, and to this side, right, cranial nerve 11 is intact. And then if you'll stick your tongue out for me and move it side to side. All right, and cranial nerve 12 is intact. All right, from here we're going to move into your respirations, looking at your lungs. So if you'll just breathe normally for me. All right, the chest rises and falls symmetrically, and the breaths are even and unlabored. I'm going to lower this bed rail here for you. All right, and if I could get you to sit up for me and turn to the side of the bed.
Yeah.
All right, just sit straight up for me. I'm going to auscultate your lungs. I'm going to listen to the front side first. All right, I'm going to start up here on the right side. Just take a deep breath for me. All right, another deep breath for me. Take a deep checking it out laterally. If you'll raise your left hand for me. Okay. Then do 2 on this side. Deep breath for me. Deep breath for me. I'm going to move to the other side. If you'll raise your arm all the way up for me. All right. One there. And one there. All right. Just stay where you are. Give yourself a big hug and put your chin down to your chest. I'm going to find that shoulder blade. All right. Deep breath for me. Deep breath for me. All right. Deep breath for me. Another one. All right. And then last one. All right, lungs are clear to auscultation. All right, I am going to now move into, you can go ahead and have a seat back in the bed. I'm gonna be listening to your heart now. Okay, all right. So I'm gonna start on the your right hand side, and on the aortic side, I'm gonna find the second intercostal space on the sternum border. That will be the first one that I'll listen to. Again, aortic, second intercostal space, sternum border. All right, I'm going to move from that second intercostal space over to the second intercostal space on your left side next to the sternum border, and that is the pulmonic. All right, I'm going to move from that second one down to the third intercostal space on the sternum border and listen to Erb's-Point. All right, I'm going to move from the third intercostal space sternum border to the fourth intercostal space in the sternum border, and I'm going to listen to the tricuspid. All right, I'm going to move from that fourth intercostal space to the fifth intercostal space and move to the mid-clavicle line, and I'm going to be listening to the mitral. All right, I hear distinct S1, S2 love-dub sounds, and there's a regular rhythm with your heart. All right, so we're gonna move from your heart to your abdomen. Okay. First thing I'm gonna do is inspect it. I'm gonna look at it. I don't see any bruises, scrapes, cuts, abrasions, no bumps. It's round, so everything seems to be in order there. I'm gonna ask you to take your legs, if you would, and pull them up and go into a crunch position for me with your head. Yes, perfect. I do not see any signs of a hernia. Okay. All right, I'm going to now check for bowel sounds in your abdomen. All right. If you'll just put your hands down by your side for me.
Yep.
All right. Starting in the lower right quadrant. The upper right quadrant. All right. The upper left quadrant. And the lower left quadrant. All right. Bowel sounds were heard in all 4 quadrants. I'm going to move from osculation to percussion. I'm going to be checking to see what kind of sounds I hear, okay? All right, there is timpani and there appears to be no dullness. All right, from there, I'm going to palpate your abdomen. If you would let me know if you feel any pain.
Yep.
All right. Any pain?
No.
All right, I don't feel any indication of any mass in there. All right, before I move on down to your peripheral area and your skin, can you tell me, have you had any issues with your bowel movements or urination?
No.
All right, and when was the last time you had a bowel movement?
Today.
All right, awesome. All right, with your peripheral area, your arms, legs, and your skin, I'm going to start by taking your temperature with the backs of my hands. The skin is warm and appears to be within an appropriate temperature range. I'm going to check for edema. I do not see any indication of edema. I'm going to check for skin tender for dehydration. There's instant recoil there. I'm going to move on to checking your capillaries in your hands.
Okay.
All right. capillary refill is less than 3 seconds. I'm going to check your radial pulse now in both of your hands. All right, your pulse is equal bilaterally with +2 strength and regular rhythm.
Okay.
I'm going to move now to your lower extremities. I'm going to be checking your temperature here again as well. The skin is warm and the temperature appears to be within the appropriate range. I'm going to check for edema. There does not appear to be any presence of edema from what I can see. I'm going to check your capillary refill in your toes. Capillary refill is less than 3 seconds. I'm going to check your Gestellus pedis pulse in your foot. And those are equal bilaterally, +2 strength, regular rhythm. All right, and then I'm going to come up and I'm going to ask you to turn on your side for me and face the wall, please.
Okay.
I'm checking your head, your scapula, your coccyx, and your heels for any issues. I don't see any signs of skin breakdown. All right, you can lay back over. And then I don't see any excessive moisture, and your skin tone appears to match your ethnicity. If you would grab my fingers, please, and squeeze my fingers. All right. All right. Strength in your hands is the same, is equal. All right, we're gonna do some flexion here with your feet. I'm gonna ask you, when I'm pushing your feet towards you, to push it back,
Okay.
and then when I'm pulling them down, to pull them up, okay? All right. All right, so the dorsal and plantar flexion is equal in both feet. All right. I'm going to raise your bed rail here. I'm going to check your IV. I'm going to check all your tubes, make sure everything's in order. I'm going to grab your call light and put it within reach. Your phone, your remote for your TV. And then I'm just going to ask you, are you in a comfortable position?
Yeah.
All right. Do you, are you currently in any pain?
I'm still 4.
Okay. Do you have everything you need within your proximity?
Believe so.
All right, and do you need to go to the restroom? Okay. I'm going to check and see where you are on pain meds, see the next time I can give them to you, and I'll be right back to let you know, okay?
Thank you.
All right, thank you.